we will discuss. I think we will discuss our paper, and then Alvan can present his paper.
That sounds great. All right, and we'll try to keep it interactive. So, I want to welcome everyone. Thanks for registering for this unique event. So this event is hosted by one of our subcommittees in the Global Neurosurgery Committee of the World Federation of Neurosurgical Societies. And in our recent and first international conference in Pakistan, one of the priorities we identified for the global neurosurgery movement was to advance research in global neurosurgery, and really considering some of the foundational ideas even in global health and global surgery in terms of the research agendas that have been put forth by those movements. So we'd like to focus in this area, and there was an ask for a journal club from many of our committee members that focused on this issue. Okay, so the panelists in today's conversation are all members of the committee, the subcommittee on research, okay, for the Global Neurosurgery Committee. Our presenting member will be Professor Franco Servadei. And I'm going to attempt to introduce him briefly before we get started. Okay, so Professor Servadei, first of all, well known and maybe known to everyone who's attending the conference today, certainly all of our panelists. He was born in Foley, Italy, and completed his medical degree at the University of Bologna, where he graduated cum laude in 1976, and then completed neurosurgery training and was certified by the European Association of Neurosurgical Societies in 1985. And throughout that period, he accrued training and practice experiences in Sweden and the UK. Subsequently, from 1985 to 1990, he was a staff neurosurgeon at the Bellaria Hospital of Bologna, followed by appointments as the director of neurotrauma and emergency care at the Maurizio Bufalini Hospital Center of Cesena. Sorry for the pronunciation, Franco. For 17 years. For 17 years, great. And then subsequently, he was director of neurosurgery neurotraumatology at the University Hospitals of Parma and Reggio Emilia in Italy from 2007 to 2016, and has been a full professor of neurosurgery at Humanitas University in Milan since 2017. Professor Servadei has been honored as a visiting professor at multiple institutions worldwide, and was chair of the World Federation of Neurosurgical Societies Neurotrauma Committee from 2002 to 2007. I'm sorry, 2009 rather. And then he was president of the Italian Neurosurgical Society from 2010 to 2012. Many of us know Professor Servadei as one of our more recent presidents, the president of the World Federation of Neurosurgical Societies from 2017 to 2021. And this was the time when I met him as a global neurosurgery fellow at Harvard's program in global surgery and social change during my travels in that role. For the past decade, he's been an invited speaker to over 70 international meetings in all 5 continents of the WFNS, an organizer of 6 international meetings himself, a reviewer and editor for multiple distinguished neurosurgical journals. And the reason why we have him leading this segment today is he's been a champion of the global surgery and global neurosurgery movements, and actually a catalyst in many ways for the global neurosurgery movement, as he became president-elect of the WFNS in 2015, which was the year that the Lancet Commission on Global Surgery released its groundbreaking report, Global Surgery 2030. And as an internationally renowned expert in neurotrauma, he has been one of the leaders in helping us to appreciate neurotrauma as perhaps the most significant neurosurgical disease burden worldwide. Okay, so with that introduction, I'm very pleased to present Professor Servadei, and we're looking forward to an interactive discussion, not only with our panelists, but if you're one of our many attendees today, please feel free to submit questions by the Q&A function or chat, and we'll try to get everyone engaged and interacting about these papers today. So with that, thank you, Frank.
Thank you, Ernest, for the very nice introduction. And during my presidency of the World Federation, and even afterwards, we realized that there was a huge disparity in the world about the workforce, production, scientific production, availability of neurosurgeons. This was also addressed before we arrived at the World Federation by many colleagues. And also the World Federation spent a lot of time in organizing training courses, for instance, in Africa, in Morocco, in many other locations, supported by the WFNS Foundation. What was not in a way addressed is the scientific disparities between low-income countries, middle-income countries, and high-income countries. Scientific disparities led to inequities of straightforward. I give you a simple example. All guidelines are based on randomized clinical studies. Application of guidelines in countries which do not generate randomized clinical study is very difficult because we do have a limit. There is one part of the world who is publishing and another part of the world who is doing the job, who is working, for instance, with trauma, with emergency, and so on. So these disparities not only need to be addressed, but we need to find a solution to improve the quality of publication. And we need to fight against the vision that the world is divided into two parts. One part is rich, have all possible devices, publish and have time to collect data. That's key point. Another part of the world do not publish because there is no time to collect data. Our effort in this year has been increasing the collaboration between these two parts and improving the quality of the scientific output from that part. In the Middle Age, one of my let's say, long Italian predecessor, Galileo Galilei, said, whenever you don't have data, people will not know you. So if you don't publish what are you doing, the people will not know who you are and where you are. So now we need to discuss this issue. We start with one paper. Sorry, I just go to the paper and then I share the screen.
Franco, let me know if you'd like me to share my screen also. I'm ready to do that.
Well, I try to do the sharing myself. If it doesn't work, you help. Okay, let's see if it works. Do you see my screen? Hello?
Sorry, I was muted. Yes, we do see your screen. It's not in presentation mode, but we're seeing the whole PowerPoint.
Now it's in presentation mode.
Yes.
Okay, so this is a paper which is not dealing specifically with the low middle income countries, but is a paper based on the 6 most common major neurosurgical journals. All of them are from US. This biometrical analysis is very interesting and has been published in 3 parts. Unfortunately, part 1 is easy to reach because it's published in World Neurosurgery. Part 2 and part 3 are very difficult to reach because they are in East European journal. But anyway, as you see it here, they have taken the output from 6 major journals for a period of 10 years, and they have seen which are the countries who are most publishing. We are not talking about low middle income countries. We are talking in general, which are the country most publishing in neurosurgery in 6 journals, which are, by the way, the highest impacted journal in neurosurgery. If we take off the Journal of Neurosurgery and Psychiatry, Neurology and Psychiatry, where neurosurgeons now publish very little, very short number of papers. So if we look at this data, you see that these are the 6 journals: Journal of Neurosurgery, Neurosurgery, Journal of Spine, World Neurosurgery, Pediatrics, and Operative Neurosurgery. This is very common for every paper published in PubMed. There has been a tremendous increase in the output production after 2017. You see that then there was a short reduction during the pandemic, but then now it's up again. And you see, these are the countries with the highest scientific production: US, China, Japan, Italy, Germany, Canada, Korea. The first country coming from the so-called low-middle income countries, India, who is located at 8th place. So as you see, the US by itself accounts for half of the production all over the world, followed by China, Japan, Italy, and Germany. These are the scientific production in the countries all over the world. So most of the scientific production is located in Europe, in US and Canada, and in the East, in China, Japan, and Korea. So India arriving 8th in this scoring. If we look at the trend of the most publishing country in medicine in the world, I'm not talking about neurosurgery. We are talking about scientific production in any field of medicine. We realize that neurosurgery is not an alien situation. It's the commonest situation. Because if you look at this, you see US, China, UK, Germany, Japan, Italy, France, Canada, Australia, the same. So let's say the possibility to publish in neurosurgery parallel the publication in all fields of medicine. We are not different from any other kind of medicine publication. Even if we look at the general, in the first 10, India disappear. So we don't even have India among the first 10 publisher of medical papers, not only neurosurgical, general medical papers. So in the first 10 publisher all over the world on medical papers, there is no one low-middle income country, 0. If we look on the right, we have the citation index. And there are changes among this scoring. You see that China is here. So China has a very high production, but a much lower rate of citation, whereas US also has a much higher production than citation. And Canada, for instance, has much higher rate of citation than production. But basically, the concept remains the same. If we look to find something like India here, we don't find it. So in the world, in medicine, is even worse than in neurosurgery. In the first 10 scoring countries for production and citation, there is no one low-income, middle-income countries. As you see it here, the role of low-middle-income countries, as you see, the low-income countries is blue, and the low-middle-income countries green. You see there is nothing there. So very little, but very little you see. Here in Asia, there is some low-income countries publishing, very few in Asia, in Africa. So, and North America and Europe and Asia, high-income country, have a prevalent role. And you see that the same is here. Here you see on the bottom the production of Africa, which is flat, and the increasing production of the other countries over time. So basically, it seems that the production was not increasing over time. And if we look at the articles per 100,000 population, we see again that only countries that I nominated you are here, with the introduction of Switzerland, Finland, Norway, and so on, but nothing changed in the. India is the last one scored here among 15 countries. And also there is a clear connection between articles published according to the general income of the countries, the GDP of the countries. You see that the per capita GDP is highly connected to the scientific production, as well as the number of neurosurgeons who are present. So we have a situation where the more neurosurgeons we have, the highest the GDP of that country, and basically the more articles are published per 100,000 population. So we do have a straightforward connection between healthy countries and scientific publications. That's the last slides of these papers, and you see that also, if we look at the type of papers who are published, you see these are short survey, review, and these are articles. You see that only India is scored in this situation. And you see that in India, anyway, most are review articles and much fewer original papers. But the scenario is clear. The neurosurgical scenario parallel the worldwide scenario for medicine by having in the first places of the countries more publishing, basically Western countries, US and Canada, Japan, Korea, and sometimes China. That's the old scenario. Africa non-existing, basically. India being one part of this, we will see in our paper that the output from India is increasing over time, is getting a better quality. There is an increasing output in Africa in collaboration with Western institutions, but that's clearly not enough. So this, Ernest, is the scenario that is reported in this paper. If we wish to discuss it, then we can move to the other paper.
Sure. We have a few of our panelists on also, so I just want to let you guys know. I saw Alvan. Actually, do you mind stopping your screen share for a moment, Franco?
Yes, yes. Wait a second. It should be okay now. It says that I'm not.
Yeah, perfect. Thank you. So we have Alvan, April, and Eliana are also on. So just want to acknowledge our other members of the research group in our subcommittee. So please, chime in any questions or comments. One comment I'll make first was in terms of the neurosurgeon density versus number of articles published. I agree with you. Certainly that graph showed a connection early on, but they said it was it wasn't statistically significant. My first thought just methodologically is that really what we want to be measuring if we're trying to understand the relationship between workforce and publications? Because you can have a very high density in a country with a very small population. And so, it's normal to expect a low number of publications. So perhaps some kind of either a sort of publication density metric would have made a bit more sense for that comparison. And I think we would have seen very clearly the link that I think is brought out, at least at the lower edge of that graph. And then similarly, you could also have looked at just the raw number of neurosurgeons. That's one situation where the number of neurosurgeons total perhaps is more telling versus the, instead of the density. But what do you feel, Franco and anyone, is one, the major takeaway, but two, more importantly, the action there is for us to take from the standpoint of global neurosurgery in response to the trends in this paper?
Well, my opinion, I will explain when we saw the paper afterwards. But the opinion is that there is a big need for collaboration, and there is a need to involve low middle income countries, authors in the projection, in the planning of the papers, in the data collection, not only in writing the papers, but from the beginning, because the methodology has to be exported. So we need people who will be able to publish by themselves, like is going now in China, in India. If you look at India, there has been a tremendous increase with good papers coming only from Indian authors. So we need to build up a process where the collaboration at certain point ends and everyone is able to go ahead by themselves. I don't know the others, what do they think?
Yeah, thanks a lot, Dr. Servadei, and thanks, NS, for inviting us to this panel. I think Professor Servadei has really emphasized the most important thing, which is collaboration. Collaboration between institutions, between individuals, between organizations, North-South collaborations, as well as South-South collaborations, which is very vital. And I think in a lot of places, in clinical practice, in training, resource development, I think there's been some level of that collaboration coming up, but I think we need to do more. And most important, since we are talking about research, there should also be collaborations for research. That also helps to build research capacity. And not only that, but also in data management, data collection. Like Professor Servadei mentioned, the low number of neurosurgical workforce in many countries, especially low and middle income countries, means that the neurosurgeons there are overworked. And so they have no time for research, and that's the truth. There is very little time and little emphasis placed on research. In addition to that, there's also no funding for research, in those countries. So with collaborations, we could be able to get funding for them to be able to do the research, as well as still providing the clinical service that they are already doing. I think there was a question that Professor Servadei posed, before this webinar started, which may be, very germane to discuss at this point. Should a neurosurgeon be only focused in clinical work, or should he or she focus in research, or should they combine both? So I think an all-rounder neurosurgeon should be able to do both clinical practice as well as research, and such collaborations will definitely help to push that through in low and middle income countries.
Yeah, I totally agree. And along the lines of what you mentioned around grants, Alvan, we have one question from our participants. It's actually one of my medical students, Jolene Singh. She says, what do we think about the struggle in LMICs to obtain grant funding for original research? Perhaps this is an area that needs attention to empower neurosurgeons in LMICs to publish their projects. Oh, Franco, you're muted. I don't know if you're...
Yeah, no, okay.
Okay.
So you mean research funding for publication? At the moment, as you see from the paper published by Alvan, it's there. The funding is coming from other institutions, is coming from Western institutions, is not coming from Africa. So at the beginning, surely, and well, for a long time, the funding should come from funding agency was solid, because there is nothing worse than give funding from the beginning and then disappear. So we need continuity, and continuity means the funding agency are solid. That's at the moment, unfortunately, only collaboration can bring funding at the moment.
Yeah, I totally agree with that. So that's why we really need those collaborations, to help bring the funding for our colleagues in LMIC countries to be able to do good research that could be published in these high impact journals, which is another point I wanted to bring up. So this paper that Professor Servadei discussed, had focused on the top 6 neurosurgical journals. And now, unfortunately, those top 6 neurosurgical journals are all domiciled in the US, and that is also a limitation, because then colleagues from LMICs may need to pay high article processing charges to be able to publish in some of these journals. And even in accessing the publications, there is a paywall, so they also need to pay to be able to access those publications. So those are all issues that limit research publications from LMICs and ability to access research, because the more you access what other people have done, then you'll be inspired to also write up some of the things that you are doing.
Yeah, I completely agree. But one comment in relation to this, and then we have one more question that we'll go to from the audience until before we start on the next paper. I noticed that obviously not only the absence of LMICs from this first paper, but the overwhelming majority of production coming from the US, right? I think that's a major takeaway of this. I think it's related to what you talk about, Alvan. And I was also, as Franco had mentioned, even part 2 and part 3 of this series were more difficult to get because they were in more local journals that actually weren't even represented in the paper. And so there is the question of local production. But what I considered was how much this reflects not only the situation in medicine, like Professor Servadei said, but it reflects the situation in international and global health policy, and in the global health space, there is a lot of talk about concerns around the neo-colonialism. There's a lot of suggestion that there is a neo-colonial paradigm in international health policy when you look at major funders of global health and sustainable development initiatives like the World Bank, like the International Monetary Fund, and you look at the relative contribution of the United States to those funds, which is enormous, right? Far, far out of proportion to any representation, any idea about democratic representation, et cetera. And that's certainly, that's even true about the UN more generally. I mean, that kind of massive financial contribution from a country is certainly going to color the decisions and policies in a certain way. And I think we're seeing that reflected in some respects by the trends in this paper as well. So the question, the last one before we go into the next paper. Okay, so Bernice Gulek, actually she has 2. So I'm just going to read both of her. I don't know the gender. I said she. I don't know that for a fact. So Bernice Gulek has contributed to 2 comments. I'm going to read them through here. The first is the issue lies in the infrastructure of doing research. Oh, yes, she. Thank you, Bernice. Okay, the issue lies in the infrastructure of doing research. 1, how does the research integrate into formal education? 2, when the surgeon or any other workforce member identifies a specific clinical question and turns it into a research paper and solving the problem. We can do research for publication, but the impact of the research would be more important in my mind. Does the surgeon have dedicated time to conduct research? And then in the next comment, Bernice says, the role of local societies also should be considered. For example, mentoring younger surgeons, but also the local societies to perform a task, to form a task force to develop guidelines on a specific issue, like in the high-income countries. So So very relevant comments. Does anyone on the panel want to respond to any or all aspects of Bernice's comments before we?
Well, Ernest, that's our comments. We share them. We agree with them. We cannot discuss because we agree with them. I wanted to add something to the question of the publication. The situation now is different from the situation we had a few years ago. No, a few years ago, the world was divided into predatory journals, were asking you a lot of money to publish your papers, and papers with free access, where high quality review was accompanied by free publication. Now, the situation is the journals, we don't call them anymore predatory. There are free access journal who requires for you to pay, let's say, between 2,000 and 3,000 euros for a publication. But if you publish in the Journal of Neurosurgery or Neurosurgery, the publication is free. But if you want free access, you need to pay $5,000. So, you know, since free access now is indispensable because a lot of the world will not have access to your publication if they have to pay, then basically the situation became equal between the publication where you have to pay and publication where you shouldn't pay, because anyway you have to pay the free access way to get into. And the second and last, I was at the British Congress of Neurosurgery and the NTS now in Cambridge, and there was a presentation from Tanzania where they did a survey among the Tanzanian neurosurgeons about the access to paper published by Tanzanian authors, though their own papers. Only 30% had access to this paper. So 70% of the people who generated papers have no access to the paper. This has to be solved. I mean, I don't think that is a big issue. Now, most of the journal have section on global neurosurgery. We have to solve the issue of accessibility. We cannot say that I build up a section of global neurosurgery, then if you want free access, you have to pay $5,000. I mean, the two things are not working together.
Right. Franco, this reminds me of the very high fees that are requested for the global neurosurgery sessions at our neurosurgery meetings. Okay. So
same thing.
Correct. So why don't we go into the next paper, Franco, and feel free to share your screen on this one, and I'm sure we'll continue with similar comments. Oh, you're muted.
Yeah, you want me to speak about the other paper, and then Alvan will speak about
I think so. I think so. I mean, we have Alvan here. So and do you want me to share my screen on that one, or are you going to do that?
No, it's okay. I tried to do it like we did before.
Okay, great.
Just give me 1 second.
After this one, I will insist on comments from April and Elian, just to prepare them.
So I think, well, I don't go to, give me 1 second. I prefer to go through the papers than going. Okay, here we are. Okay, we share the screen. Okay, can you see my screen?
Yes.
So this is the paper we published in 2021, where we did, let's say, first of all, when I became the president of the World Federation, I was interested to see the output of low middle income countries in scientific production. Basically, there were very few papers, so we collected a group, international group, as you see by the name here. There is Cambridge, my university, Indonesia, Pakistan, India. So we collected a group of people who was interested in looking at the publication from low middle income countries. And we published our first paper in 2019. The first paper was dealing with the production, the footprint production between 2015 and 2017. What we discovered, and it was clear to everyone, but it was never been demonstrated, that only 5% of the publication all around the world were coming from low middle income countries. Attention, well, I submit to the panel one key issue. What is the definition of a paper coming from a low middle income country? It seems easy, but it's not easy. Before we realized this overview, the definition was even one author from low middle income country among 12 authors was enough to score the paper as coming from this country, which is the policy of PubMed. PubMed policy is attributing the papers to all the countries of the authors. If 12 authors coming from 5 countries, the paper is attributed to 5 countries. We decided at that time, there was no previous experience, so we decided that we should have the first author from low middle income countries or the majority of the authors. So 10 authors, 6. Otherwise, we didn't score the paper. We have been criticized because with this policy, we excluded quite a number of collaborative papers between US and Africa, for instance. But we thought it should be clear that the participation as authors to this production was the most important. Afterwards, the last paper we published in neurosurgery and the last papers published took another definition, which is the Scopus definition, which is either first or last or corresponding. One of these 3 attributes to the country the paper, which is another issue. So in this paper, to be comparative with the previous paper, we use the same entry criteria, meaning either first or majority of authors. So if you look at the study, well, as you see it here, sorry, but I cannot eliminate maybe here. Yeah, okay. Now it's okay. Well, we did the PRISMA research as usual. We identified 486 studies. The journal list, as you see it here, is different from the one we saw before. It's all the neurosurgical journals with an impact factor over 2 at the time in which the research was done. So we have also European Spine Journal, we have Acta Neurochirurgica, we had some few other journals, in particular European journals, as compared to the study you have seen before. But this is the shocking representation of the number of only 5% of studies were published by low middle income countries, and only 0.2 were published by low income countries. So as you see it here, the numbers, if we score 2018 to 2020 versus 2015 to 2017, the numbers are the same. So during this period, where I was the president of the World Federation, we had committees on global neurosurgery. We started to discuss the issue. We started to see that there was a problem, but the problem clearly is not solved because the number of publications remains the same, even if more recently there has been some increase. The other issue is the topics. The low middle income countries topics, you see it from the, here, there is a, no, what is it? Well, anyway, I tell you that the topics are basically mimicking the Western topics, not taking into, I mean, we know that in this country, one of the main issues are traumatic brain injury, spine brain injury, and pediatric neurosurgery, whereas the topics published are in most part tumors, skull base, and vascular, which are basically not on the top of the work they are doing. So there is a sort of mimicking policy towards the Western countries. And as you see it here, there is a clear Indian overrepresentation. Well, let's say India even increased between the two periods, and all the other countries have limited access. We will see that if we talk about collaborations, India is not on the top, obviously, because in India now has reached a level in which there is a possibility of self-publishing. They don't need other countries. But there is a trend towards an even better representation of India in these studies. And as you see it here, the most important issues are basically spine, vascular, followed by vascular and brain tumor. Trauma, both spine and brain are behind, even behind, let's say, others. And if you look, pediatrics is only 5% and hydrocephalus 2%. So the topics are not representing the disease who are present in this country and are not representing the workload of the neurosurgeons in these countries. And these are the various journals in the two periods, and only world neurosurgery, spine, and focus increased the output of low middle income countries. All the other journals either remain equal or decreased. So there has been not much done. We have to say that after years, our study ended at the end of 2020. After this, both the Journal of Neurosurgery and the Neurosurgery have established a dedicated section to global neurosurgery, which were not there before. But this was done because it was clear before that there was an underrepresentation of low middle income countries in any publication in these journals, as you see it here. And I think the conclusion, it's from this survey, it's first, talking about global neurosurgery doesn't mean improving the capacity, or talking about education and research does not automatically mean that we solve the problem, obviously. Second, a more structured approach is required in journal, and what is needed is practical suggestions. We do have quite a lot of Western institutions. I just give you the example of the Duke and Cornell in US, of the Valencia University in Spain, of other institutions in China, for instance, who are collaborating with institutions in Africa or Asia since years. So what is needed is from their suggestion of what should be our practical work to help them not only to produce, but to have a better capacity of work in which the scientific production and research have a part as it is for us. So I think I can stop the, okay. Now I can stop the sharing.
Awesome. Thank you. Thank you, Franco. Okay. Yeah, I think this is raising a lot of interest. So first thing I want to do is read a question that was asked earlier. So it was actually the tail end of the last paper. May relate here. This is from Jonas Saint-Fleur, who asks, some US residency programs, especially neurosurgery, look to select students with a high number of publications. How much does this factor into the overall production of publications?
Well, Ernest, this is you to answer.
Yeah, absolutely. I do have a thought about this, which it raises a couple of things. It is a factor. I think it would have to be studied to understand to what degree it is, it's a major factor. But here's what I will say. In the US residency match, publications certainly are a factor, and even more so a factor for international medical graduates. Okay. Without moving completely into a question about physician migration, human capital flight, and concerns like this, which are also relevant, I think it is important to recognize that a lot of the applicants who are driving this publication record may be from countries that are very poorly represented in terms of global research productivity, but nonetheless, because of new institutional affiliations in the US, are driving up publication numbers. So I think this is a real factor that merits some attention. I see Hal Mangat with his hand raised. Hal, I'm gonna put you on audio so you can provide your comments or questions.
Hi, good morning. This is Hal Mangat. I've been involved with the Cornell Tanzania collaboration for over a decade. Thank you, Dr. Servadei, for a beautiful talk, and Ernest for organizing it. I think to your comments, Dr. Servadei, we've learned a lot of lessons in our collaboration. I think the number one is the longitudinal collaboration over a decade. When we started, we were mostly doing clinical capacity building, and then we transitioned to education with our annual course, and which used to be about 30 to 40 participants and now has over 200 participants every year. And the third frontier then became research, a big basis of that being when we started off, at least when I joined Roger in his third year or so, there were 2 neurosurgeons at the National Institute, and today they're in the vicinity of 10. And therefore, now there is the time and space component of being able for the local faculty as well as residents to participate in research. So I think that's the one thing. The second thing we've seen is overcrowding of the space, as in now a directive has been issued that there's so many courses going on that OR cases were getting cancelled, that now no OR case is allowed to be cancelled. So there is a certain overcrowding of the space as well. Lessons learned, I would say, is we we should have a paper coming out in neurosurgery shortly, is how many papers that are published within Tanzania are open access and even accessible to Tanzanian neurosurgeons. So we did a systematic review, should be out in neurosurgery. Of course, the fraction's minimal. So going forward, we are trying to adopt a model that we only publish open access. The second thing is actually, we went through a spurt where we published a lot of papers. And then I think we've done the full circle coming around to saying, are we publishing impactful, meaningful papers? And then I'll leave it with number 3, which I think also warrants a discussion in this whole sphere, is how do we define authorship? So the fine balance between looking good and providing gift authorship versus respecting journal guidelines for authorship. And we are trying to move towards the group authorship model, where we name the group and we publish have the main authors who've done the bulk of the work on behalf of the Cornell Tanzania group. And I think that is something I would like to hear your thoughts on, is how do you define the authors, and whether moving towards a group publication model is a good idea. Thank you. Sorry, that was a long one.
Well, if I can quickly answer to a difficult answer, very difficult. Well, I think the way in which you have been working in Tanzania is an example. So you did a very good job. Many of your papers have a follow-up with practical suggestion about how to improve the situation, and this also is important. The issue of the authors in the papers, as you see, as we discussed before, is a big issue. Ernest, one thing we can do is promoting a common definition. There is no accepted definition of where is the involvement of low, middle income countries in different papers, in which percentage are they prevalent, what should they do, and you mean, Alvan will show you soon the papers on global neurosurgery, and let's say over 20% of these papers have no authors from low middle income country, and the majority have only one author. So we need to establish a common definition of contribution of low middle income countries to collaborative papers who is not there. So I think one body like our body, like the Global Neurosurgery Group of the World Federation, can discuss and exit with the proposal of a common definition, which should be used in the future to publish papers, because we gave our definition. The papers from Cornell have one other definition. The paper of Alvan has another definition, but because there is no one well accepted. So that's my proposal.
Can I enter in this? I just want to comment, because I don't understand what Professor Servadei is meaning with a definition for authorship. What do you mean? Is it a guideline?
No.
Or am I not understanding what?
When we are collecting papers, when we started to do the collection of paper from low middle income countries, we don't know what to collect. There are papers with 12 authors, one from Africa and 11 from US. Is it a paper from low middle income countries or not? There are papers where only the authors with corresponding is from low middle income countries. All the others are not. So I think, Eliane, we need to establish a common definition. Otherwise, we cannot compare different studies, because we don't know what we are collecting.
Yes, I understand. Okay, now I'm following. Yes, and that will be very difficult to do, because an affiliation to a hospital doesn't automatically mean that someone is from a low middle income country or not, or has a different background, identification, etc. So that will be very difficult to make, but yes, there needs to be a start in making guidelines, I think.
Well, many journals now requires you to state where you are based. So, for instance, I come from Tanzania, but now I am at the Cornell University.
Yeah.
Many journals now, I'm reviewing papers, they ask you, it's mandatory to tell where are you, if you are there or if you are there. But this is something that needs to be discussed, I agree.
So many interesting points. Hal, I'm going to promote you to panelist if you're able to stick around for the rest of this. And then I think April has a comment to contribute here. So before I go to April, the first thing in terms of advancing a common definition for authorship, Franco, I'm on board with this. I think, and Hal and I have discussed this actually relatively recently. The fact that, or the question about whether, first of all, I see MJE guidelines accurately represent what should be considered authentic, authorship and contribution from low and middle income countries. And I think it's certainly worthy of review and discussion. And I would also favor this. And I think this is one thing that our research group can take on and start to advance. That's the first issue. The second issue is in terms of how we're doing it. I would say that the positions of influence in a paper, right, and the positions that represent where the grant funding is coming from, who really did the writing, how this was conceived. I really think that comes down generally to the first author, plus or minus the second author. So I'd say the first couple of authors, and then the senior author, of course, who is very often the corresponding author. And so, when you look at it from that perspective, if you have a paper with 12 authors, right? And then of those 12 authors, 8 of them are from LMICs, but the first author and the senior author are from the US, I hesitate to call that paper coming from, an LMIC. I think this is also very important to consider. And I'm not, saying it should be one way or the other, but this is an important discussion for us to entertain as we're thinking about how do we want to promote qualifying a paper as coming from LMICs. And then the last comment I'll make is with respect to the work Hal mentioned that they were doing in Tanzania, and the fact that Tanzanians rarely even have access to papers on research done in their country. I experienced this directly in the work I did in Haiti. When we published on the neurological and neurosurgical disease patterns at 3 referral centers, it was important work because we had a sample of over 7,000 patients and felt that we were actually getting a real view of acute care neurological epidemiology in the country with that data. And it bothered me that most Haitians couldn't access that. And so I asked World Neurosurgery to relax the copyright of that paper so that I could use that data in a publication that I subsequently prepared in French and published in Haiti's local medical journal, Infochir. And that was welcome. And now all of a sudden the Haitian medical community had, full access to this. And I actually included some additional data that wasn't even in the world paper, just because I couldn't deal with that disparity. It seemed to be, completely contradictory, like antithetical to the whole reason for doing the work in the first place. So I think this is also an important issue for us to think about as we're publishing in this space. April, what comments would you like to offer here?
Well, thank you, Ernest. Thank you for including me in this panel discussion, and thank you, Dr. Servadei, for that very insightful talk. So I was listening. I think the perfect segue was that from your last comment after when you ended the discussion of the paper, you talked about what are we supposed to do, and I think the main thing here is, at least for us in Mission Brain, we're looking at it from a structural point of view, a systems-wide approach. From our experience, I mean, my personal experience, I grew up in the Philippines, and research was never an emphasis. So you weren't really provided with the skills on how to do research. And we found that that's pretty common in a lot of LMICs. So for us, for example, we started a research peer mentorship program to really take those from basic or without any kind of research experience. And Eliane is one of the mentors there. So I think that's one way to address that, is really structurally, is there emphasis on research in a lot of the education that's being provided in LMICs? And I would hazard to guess that there isn't, for many different reasons, right? Resources, or even the sort of the idea that what is the point when we're not going to be able to publish, or the research that we're going to do is not really going to change anything. So I think there's a lot of that barrier to first consider. We have to be able to put emphasis with that. That's something that we also heard in our partners in Mexico. So there's not a lot of research. There's mostly the emphasis is on clinical rather than any kind of research for neurosurgeons or for the students. And then there's availability of mentors. So when we started the peer mentorship program, we had close to, I think, about 200 applicants. And we couldn't really find enough mentors to cover that. So we had to cut it down. Then we found out later on that there was a lot of interest from other people to become mentors. So I think that's one way also, is to have that collaboration to really pinpoint who are the potential mentors and mentee in all these relationships, right? Not maybe just institution to institution, but on a wider scale within the Society of Neurosurgeons or neurosciences. And I'm a nurse by practice, and by extension, that whole thing as well. And then you look at the mid practitioners in the mid range of that whole structure, the junior attendings and all that. So there's no financial support. There's really isn't, and I think Dr. Alvan said about the time that's needed for research. In the US and high income countries, there's research time and clinical time, and that's not necessarily the case. And we have to look at structurally government support, institution support for a lot of the neurosurgeons practicing in LMICs. Is there really an avenue for that for them? So how, and then Ernest, you talked about policy. So how does that sort of play into that? And what can policy do in terms of, for example, we're talking about capacity building a lot these days, right? So how does that factor into advocacy in terms of the governments that want to support neurosurgical capacity building? And then there's journal application barriers. So I think Eliane and I were in a very interesting lecture from an editor, a neuroanesthesia editor, about some of the criteria, right? So I think there's still a huge sort of issue in terms of gatekeeping and who gets to apply, what are the necessary steps to apply. There's also the perception that editors have a selection bias in terms of what names or authors appear on a paper that's being, submitted for publication, right? Whether it's a well-known one or not well-known one. And one of the things right now that I've had to grapple with in overseeing our peer mentorship program is also the idea of, okay, how do you balance the output, just the quantity over quality? So obviously those who are starting out will probably try to just be able to write papers and then there are going to be those who are going to be able to have quality papers. And then so you'll have people, well, this one gets more citation because it's quality paper. Yeah, but that's also from someone more well established. So I think we have to sort of make some room for that. And then I also would like to comment, and this is more of a question actually, but maybe before I do that, I think it's been discussed already, the higher structure, right? The journals, the high income countries, I think has a lot, the onus falls on a lot of them in terms of being able to really open this up. If we're going to address disparity, I think it has to come from there a lot of times. So what is the buy-in, right? Because obviously we have to go to these people, to the gatekeepers and the journal editors and all that. So what's the buy-in? And even I guess the thing is, it's all sort of new. Even global neurosurgery as a specialty is fairly new, and we're advocating for that. And then finally, I think when I was intrigued by topic mimicking, the mimicking of topics of a lot of, it was pointed out in the paper that was discussed. And I wonder whether, is it because, I wrote down my notes here before I forget, is it because of the criteria, or at least the perception of some criteria as to what major journals might accept? So then, of course, if I'm an inexperienced journal researcher, and I'd really like to have, I think, motivations are different motivations, right, for writing a paper. One is really the altruism and the idea to have impact. The other is to boost your career. So the perception that maybe a lot of those high income country topics are going to get me published, then of course there's a migration towards trying to do those topics. And then the mentor interest. I mean, a lot of those coming from LMICs, when they publish papers, are being mentored from HIC authors, right? So then whatever their mentors' interest, or even the grant funders' interest, I think those are some of the things that really need to be considered. There's also the language issue, right? We touched on that a little bit, Eliane, I think, if you recall, about the barriers of non-English speaking countries. So I think there's a lot to consider, but at least from our standpoint at Mission Brain as well, what we're trying to do is, now we're looking into, when we grant scholarship grants for those from LMICs, we really want to consider, or even those from HICs who are working in LMICs, that authorship and addressing research diversity is an emphasis for us. So I think that part of advocacy for nonprofits like ourselves, or societies like the WFNS or the GNC, I think goes a long way in supporting the efforts that we're, the goals that we're trying to advance here today. So I think that's long, but you wanted me to comment, so that's my comment.
No, that was great, April. Thank you. I took some notes from your comments, because on your comments, we could probably design every one of our following journal clubs, because you raised some really important issues. And the work you're doing at Mission Brain, particularly around mentorship and research capacity development, is also a form of advocacy. It is one potential reply to a question in the chat from Fleury Volsi. I'll read this comment and question. Fleury says, India is the country with the most contributions among the LICs/LMICs. What do you think is holding back the other LICs/LMICs from publishing more? And what practical steps should we take to help them increase their research output? We should look into what strategies India has put in place and see how we can replicate them in those other countries. So, I think we've been hearing about some important strategies, certainly around addressing this structurally, the way you spoke to April with the mentorship program. We've talked about the importance of collaboration, and I don't think that can be emphasized enough. But I was also particularly interested in India and how India showed up over the course of these first two papers we looked at. Do you have any insight, Franco, or anyone else, into what has driven the sort of the boost in academic productivity from India versus other LMICs?
Well, India has a long tradition of a strong British educational system. And many of the Indian neurosurgeons that we know have been educated in the Western. So when they came back, they brought with them strong research and education programs. If you want to become a neurosurgeon in India, you have to go through steps which are very similar to ours. So it is, in a way, also remember that India's production is underestimated, because the Indian journal is called Neurology India, not neurosurgery, because Eileen there knows the Indian journals and the Indian Society of Neurosurgery is called the Neurological Society of India for historical reason. But for this historical reason, when you review neurosurgical papers, this journal is out because it's not in the list of the neurosurgical papers. So I believe that India, and if we look at the collaboration between Western countries and low middle income countries, India is decreasing, because India has already got the possibility to publish and do research by itself. And we have to consider that in recent randomized clinical studies, Indian centers have been involved. If you look at the data from the acute subdural hematoma randomized ICP study, 40% of patients came from India and Pakistan. So there is already a tendency to involve Indian researcher and Indian patient into complicated randomized studies. So I think India is stepping up, and it's a similar way to the way that China has followed in another system. The system is totally different, but in a way, the education in India is improving.
If I may share my own personal story, being Indian in background, but I sort of only went to India for my medical school, and in my internship, a faculty member suggested a research project that eventually ended up becoming a phase 2 trial. And this is 1994, so it's 30 years ago. And we submitted the paper to CHEST 30 years ago, when I was like a low-lying intern, and we had comments from, incidentally, when it was Index Medicus and not PubMed, we had comments about everything from line spacing to font and everything. The last comment from the editor was, if we changed our conclusion, they would reconsider and potentially accept it into CHEST. And my mentor put a lot of pressure. He's like, you're going to get a really strong publication, will help you get into residency, just change it. And people who know me will know how stubborn I am. So I didn't, and we presented it elsewhere, it got published. But I think those are the things where these are the unseen pressures, forces that also drive research that, for example, strategically placing an author as a corresponding author to try, to be able to publish open access and so on. I think that these are, we also, while we work on the mechanics, we must also work towards making sure while we do that, we continue to uphold the integrity of the work being done. I think I think India is a great lesson, not just in research, but if you look at neurosurgical implants or any materials that are required, how India has been resourceful to be able to accomplish all that. A lot of that has been on the back of a British-style education system. However, that probably held a lot more water till about 20 years ago, since when laws changed. Another comment I wanted to make was, I wonder if, as an organization, there should be an effort to one, actually map out all the collaborations in terms of what's happening of crowding of the space, and in a sort of very harsh way, neo-colonialistic approach of on research. And then the JME guidelines are based on, for example, the Western resource system, where people have time for research and so on, whether these need to be adapted to, surgeons who work 12-hour days and then are facilitating remote partners into sort of collecting data for remote partners. I think those fundamental definitions of roles need to be changed. It's taken us a decade to change that. But I think those are certainly the steps to take, and to be able to form a coalition where all this work is potentially represented by, not fractured, but represented by, for example, a group like this or so, where resources are pooled, as opposed to there is now competition on the ground for access to sites, because global health has just become fashionable. Yep, thank you.
Thanks so much, Al. A lot of great points there. And given we have just a little over 10 minutes remaining, Alvan's paper will pull together a lot of these issues. I'm going to invite him to comment while I share my screen, unless you wanted to share something, Alvan. Is it okay for me to share?
Yeah, I can share my screen.
You can share your screen. Very good.
Do you see my screen?
It's coming up. I don't see it yet. Oh, there. Now I see it. Very enlarged. Yes.
Yeah. Once again, thank you, Ernest, and for organizing this, and thanks, Dr. Servadei, for really leading this and doing justice to the discussion. So we adopted a slightly different approach from the other papers that have been presented. And basically, some of the key questions that we wanted to answer were, one, who is publishing? Where are they publishing? What is being published? And who is the audience? So who is the recipient of this publication? Again, is the publication accessible? And finally, who is funding these publications? And we started by maybe adopting a definition of global neurosurgery, as proposed by the Global Neurosurgery Committee of the WFNS, as the clinical and public health practice of neurosurgery with the primary purpose of ensuring timely, safe, and affordable neurosurgical care for all who need it. So in doing this, we then went ahead to define the countries, low and middle income countries and low income countries, from the World Bank classification. Again, we adopted some of the other limiting criteria, as other similar bibliometric studies, so only English language articles, but we expanded the dates, so that there was no date restriction. Of course, most of the articles were mainly research articles and review articles, case reports and other articles were excluded. So looking at the results, at the end of the day, we included 337 papers. So some of the key takeaways, which relate to all the discussion that we've been having today. So one key thing that we did here was that we searched multiple databases. So we didn't restrict ourselves to maybe only Scopus and Embase or PubMed. We searched at least six databases. We went ahead to search the Global Index Medicus, in order to include publications in journals from low and middle income countries which are not ordinarily indexed in PubMed or Scopus or Embase. So that way we were able to retrieve papers from African Index Medicus, the Latin American Index, and even the Southeast Asian Index. And that kind of expanded the number of journals that were also included. But at the end of the day, just like has been presented previously, the top journals remained some of these. So World Neurosurgery, Neurosurgical Focus, Journal of Neurosurgery, GNS Pediatrics, Child's Nervous System, and Neurosurgery. So some of these journals had not been previously mentioned before, like Child's Nervous System and Neurosurgical Focus, but because of the expanded search that we did, which pulled in multiple publications from all these other indexes, they somehow came on board. In terms of the authorship, again, the US maintained the lead in the first authorships as well as the last authorships. But we then see that some other, because of our inclusion and exclusion criteria, the next country that we see was Uganda, which has a lot of collaborations with US-based institutions such as the Duke Global Neurosurgery, where I currently work, as well as the Cure Foundation and multiple other organizations. Of course, we also see Tanzania among the top 10. The work of Mangat, the work of Elegala with Madaktari Africa, Well Cornell, and several other organizations, also help to put Tanzania up there. And of course, India, and most recently, especially in the last 10 years or so, Nigeria has really had a remarkable outputs in the global neurosurgery literature. And then looking at the authorship by institutions, again, all these institutions are based in the United States, and most of them have collaborations, existing collaborations, long-term collaborations with the institutions in these in LMICs. Now we took a look at the funding, and then we see that the National Institute of Health Research, that's out of the UK, is the most prominent funder for global neurosurgical research. Of course, the NIH and NIH divisions, such as the Fogati, also fund significantly. But some of the other takeaways relate to the authorship, like Dr. Servadei mentioned before. So about 50% of the publications had only one author from an LMIC. In fact, we had more than a quarter of the publications, about 28%, which were papers published on LMICs, talking about neurosurgery in LMIC settings, development of neurosurgery, capacity building in neurosurgery, yet they did not include a single LMIC author. And then we had very few papers which had maybe at least 2 or more than 3 LMIC authors. So this was really the highlights of the work that we did, the authorship distributions as well as the funding. We have gone ahead to, to do a little more work on the funding. We have a recent publication that's been accepted by World Neurosurgery, which should be published soon, which focus more on the connectomics between research, authorship, and funding for LMICs. And just to digress a little bit on funding, as has been pointed out, of course, we always say that the piper dictates, the one who pays the piper dictates the tune, right? So we see this is the global health financing, the most recent information on global health financing, and we see that as at last year alone, $64 billion was spent in financing global health all around the world. Most of this funding came from the United States. So in the first column, you see the sources of the funding. In the second column, you see the channels through which those funds were distributed. And then in the third column, you see, the focus for those funding, the areas that were funded. So again, we see that the United States took the lead, with up to more than 30% of the funding. We also had several other governments, including private entities like the Gates Foundation. And then looking at the focus of the funding, most of these are not neurosurgery related. So most of it are, infections, child health, maternal health, HIV/AIDS. Neurosurgery probably comes in amongst the non-communicable diseases, which are accounted for only 2% of the global health funding. So in funding global health, some of it also trickles down into research, so we see that very little is funded, it is kept aside for neurosurgery related conditions, of course, including research. So I think maybe I'll end there for now because of the time that we've already spent. Thank you once again, Ernest.
Thanks, Alvan. Fantastic paper, and indeed pulls together a lot of what we've been discussing and raises some other new points of interest that I think are going to be worth building on in our future sessions. We're down to the last 5 minutes before we end. I want to read out the final two Q&As that I have here. One is a comment it says from Bernice Gulek, who says, I think the group authorship fosters involvement at all levels and assists with mentoring, able to hear people from novice levels that provide a unique lens. And I think that's a nod towards one of Hal's comments earlier about the value of group authorship. And then an anonymous attendee says, as the LMIC countries develop research capacity, quote unquote, to keep the trend and understand, may consider looking into first authors from LMICs and or include the number of authors that contributed to the publication over time. As the proficiency of researchers increases among the LMIC researchers, the demographic will change over time. So not so much questions, but highly relevant comments. So thank you both for that. About 4 minutes left here. Franco, may I invite you just to make some concluding comments, and then we can wrap this session up.
Well, I think, Ernest, I made the introduction, you made the conclusion comments. We have been talking quite a lot, and I think it was very fruitful discussion. Many points who came out are on the table of people publishing and trying to get data collection. One thing which is not been, I think, because of me and many properly addressed is data collection. Because publication on personal experience needs data collection methods, needs a simple core data set, for instance. Which data are we going to collect? And this is where the Western countries can help. We have the methodology, we know how to collect data, we know for experience in which field these data are important or not. And I am reviewing papers for many journals on neurotrauma, and very often they go out of the track. They are collecting data who are really not useful, and they are not collecting the core data that we use in the Western countries to publish. So it doesn't matter that we are right or wrong, but if you want to compare your data with the other data, you need to move on the same track. That's my last suggestion, and I leave the last word to you, Ernest.
Thank you. Appreciate that, Franco. 2 minutes, so we're going to close this out. Thank you to everyone for your participation. This was a very lively discussion, participation both from our panelists and our attendees. Thankfully, this is not a one-time deal. This is an inaugural session for a series. And, I think what we did is actually defined a prospective agenda for our upcoming talks. We talked a lot about the lack, the major research and data gap, to your point, Franco. So the data gap from LMICs, defining authorship, topics of publication, which is a whole other issue, and the mismatch between actual global neurosurgical disease burden and what people are publishing about and why that might be. Entry access concerns, structural concerns, promoting collaboration, grant seeking, language issues, and so much more. So I think this was a very fruitful discussion. Thank you all for your engagement and your participation, and looking forward to having more such journal club discussions in the next couple of months. So with that, you're very welcome. Take care, everyone, and enjoy the rest of your weekend. Bye-bye.
Thanks.
Bye. Thank you. Thank you all.
Bye-bye.